You're right. We're about ready to start now. I'm Elliot Stone, your moderator. Joining me will be Linda Laderman, a life care planner of 30 years, we'll both be taking your question and answers at the end. And there's a box on the right side of your screen where you can type in your questions. It's on the right. And we'll take the questions at the very end. There will be two recurring themes in this webinar today. First, the critical importance of providing future hard medical costs to your adversaries, especially on the numerous mid-range cases, so as to increase firm settlements. Secondly, there'll be your ability to provide medical cost reports with no initial cash outlay on a lien. Now let's go now to page 1. And let's begin with a brief introduction about life care plans for those not totally familiar with them, and then we'll go on to medical cost projections, which are life care plans for smaller $50,000 to $500,000 files. Life care plans are utilized to maximize settlements in personal injury cases. Typically, they've been used on 7- and 8-figure cases due to the cost. The fees for their life care plans run $5,000 to $25,000 per case. Many life care planners charge by the hour, bringing uncertainty to the final cost. The plans are generally used sparingly and later in litigation to preserve working capital with the hope of bringing about a settlement with expense reimbursement. The more numerous mid-range cases, neck, back, with continuing medical treatment with injections, radiofrequency ablation, possible surgery, worth $50,000, $100,000 and up, have not warranted life care plans, at least till now, again, due to cash flow constraints. Our interest-free life care plans on a lien, payable at settlement, is a real game changer that will dramatically increase usage and firm profits. Let's go to the next page. Life care planning has grown dramatically in the last 30 years. The plan was first invented, so to speak, by Paul Deutsch and Fred Raffa about 30 years ago. And plans are valuable in managing catastrophic injury and illness, TBI cases, etc. And the methodology provides professionals with a consistent process for analyzing the immediate and lifelong needs. They're utilized by courts and juries to better understand the effects of catastrophic injuries and economic damages. Let's go to the next page. So, what is a life care plan? It's a document that provides an organized, concise plan for current and future medical needs with costs. It accounts for the medical care, rehabilitation, and these are done typically by board-certified professionals, including rehabilitation counseling, nursing, psychology, physiatrists, and case managers. And there's typically a board certification in life care planning granted by a commission. The plans are typically based upon medical records review, client interview, practice guidelines, etc. Next page. So what's included in a life care plan? Some of the things: medication, wheelchair needs, projected routine future medical care, orthopedic equipment needs, surgical treatment, home furnishings, aids for independent function, etc. Next page. Here you can see a Venn diagram with two different areas, one for the medical cost projections and the other for the life care plans, kind of comparing them. They both build case value. Life care planners are used for both. They're available for testimony. And the experts don't work on contingency. They're paid right at the outset for the plan, and then you pay them if they testify. The projections, though, are used on smaller cases, valued $50 to $200,000, $500,000. They're used early on, even pre-lit, to help bring about a settlement. The clients and treaters are not interviewed, but the expert relies on medicals and local pricing. There's a flat fee of $2,000 or $4,250 on a lien, turnarounds 3 to 5 weeks. As you can see on the right, the life care plans come in later in the case, and non-catastrophic plans on a lien are $8,500, catastrophic $17,000, vocational and economic $4,750. Next slide. Here you can see a summary overview of two sample plans. One is catastrophic, the other is non-catastrophic. You can see the catastrophic is valued at about $1.7 million, and you see there's a lot of that due to the home care and home services. Obviously, that person is no longer independent. The non-catastrophic case on the right, which often would be a medical cost projection, here was $260,000. Again, this person has very little home care net needed, only $9,600. Initially, an adjuster on a case like this might offer $25,000 to $50,000 to settle. And let's go to the next slide, which is a medical cost projection, a sample one. And you can see the expenses here on the left: chiropractic care, the annual expense, physical therapy, orthopedic eval, arthroscopic repair, post-op physical therapy, etc., etc. And here the total's $194,000, which is typical for a medical cost projection in that range. Next slide. Let's for a minute focus on the much more common mid-range cases, valued at $50,000, $100,000 and up. Most attorneys have anywhere from 5 to 20 to even more cases that fall in this range, clearly many more than the rarer catastrophic type case. Now, the non-catastrophic cases that warrant medical cost projections or possibly life care plans, again, they're minimum $50,000 to $100,000. The client has to have some continuing medical issues, and the adjuster's offer, if any, is unacceptable. The adjuster may say that your client's a malingerer, show me your damages instead of talking about them. Now you'll be able to do that, and that's when the value of the lien-based cost reports really come into play on these types of cases. MVA, slip and fall, neck and back, etc. Let's go to the next slide. This is a typical motor vehicle accident commercial policy case where you can see the benefits of these plans. Here, the policy is $250,000. The life care plan or medical cost projection, let's say, comes in at $400,000. And it makes sense to, especially if it's a medical cost projection, to commission it right at the get-go, even pre-lit. The adjuster on the case offers you $25,000, $50,000. You want to push up the reserves and get your client the fair compensation. Now, if you do a report, and let's say that report comes in at the $400,000, let's say, that's well above the policy limits, and you know the adjusters who are risk adverse are going to bump up the reserves and the ultimate settlement probably by a minimum of $50,000 to $100,000. They don't want to be stuck in a bad faith situation if the jury actually awards the life care plan amount. And typically they don't bother getting life care planners to rebut this unless it's a real catastrophic type case. So let's go to the next slide. Here you have a couple of testimonials on life care plans. The first attorney was offered $7,000 for a fractured leg, a herniated disc, and fractured tooth. The plan helped to get him $200,000. The policy didn't have to put up any money. The second case is more of a catastrophic life care plan on the right, where the attorney settled for $1.75 million, and the benefit to him was he didn't have to shell out $15,000 or so to get a life care plan. It was just an expense to the file, and it was paid out at settlement. All right, the next slide. Here are some testimonials on medical cost projections. The first attorney had a motor vehicle case where there was some chiropractic care, one epidural injection, and with the plan, he wound up getting $100,000, saying normally it would take 3 or 4 rounds of epidural injections to get that amount, but here they caved in on the policy. The third testimonial shows you how you can go after secondary policies if your plan exceeds the first policy. Here, there was a UIM carrier who offered him $2,500 after the primary policy was settled, and the projection helped to get him the full $35,000 on that case. So again, you can bring in multiple policies and get them with a good plan. Let's go to the next page. Now, I'm not going to go into too much detail on this chart. We're going to send a copy of these slides to everyone at the conclusion so you can pour through this yourself. But this is a way to show you how medical cost projections and life care plans, how successful you can be in getting more money, and often sooner. The first case was a $200,000 policy where they were offering $12,500. The plan came in at $202,000. It went to mediation, and the attorney got the plan, the $200,000, and he got that 5 months post-demand letter. Our statistics here for these 8 examples, the last few are life care plans, show that on average, after using one of these plans, the case settles about 6 to 8 months later, and the client gets about 8 to 10 times the initial defense offer on these cases. The bottom 3 cases were catastrophic cases where the attorneys would have gotten life care plans anyway, but it would have just been later on. But they would have had to have gone into pocket to pay for those plans. Here they don't have to. Again, the beauty here is by using these plans early in the litigation, you can push the adjusters to raise the reserves and settle sooner. Let's go to the next page. The lien underwriting and funding process is pretty simple. You're simply going to apply to our underwriters describing the case, the coverage, insurers, theory of liability, damages, documentation. In 1 to 3 days, our underwriter confirms everything. They want to see that the case has legs. And then, assuming you're approved, all the records in the case goes to the life care planner, who upon completion is promptly paid. Should testimony be necessary, the attorney pays the expert their customary fee. And for testimony, it's usually $4,000 to $5,000, somewhere in that range, depending on the expert. Upon settlement, the funder is paid back, or is paid $8,500 on a typical life care plan that's non-catastrophic, or $17,000 if it's catastrophic. If you lose the case, you don't owe anything. This is all non-recourse, so it's risk-free. With medical cost projections, typically you're going to pay $2,000 cash, or $2,500 if you want an MD life care planner versus a nurse, $4,250 if it's on a lien. For the life care planners, if you do it cash, usually you're looking at $5,000 to $6,000. Next slide. We also provide vocational and economic experts, also available on a lien. Vocational looks at the vocational handicaps, the impact on job alternatives, placement, and they come up with with a plan and what the limitations are. Typically, an economist will work off that and put it into present-day value. And that's really what economists do. They put the plans into present-day value, and they're available to testify as well. Their fee on a lien is $4,750, or cash it's $3,000. With the next slide, you can see the application form. It's pretty simple. You're just going to fill this out for a life care plan, and then the next page is for a medical cost projection application. And now, in conclusion, and we'll take questions shortly, with medical cost projections and life care plans on a lien, attorneys no longer have to leave money on the table for deserving $50,000 cases and up. You can now utilize these products practically cash and risk-free to both deserving catastrophic and non-catastrophic cases, maximizing settlements and firm profit. In a minute, I'll be asking Linda, our life care planner of 30 years, a few questions before taking your own questions, which again you can type into the box on the right of your screen. Now, afterwards, we'll send all of you both a 2-minute animated overview of the service along with the complete webinar to share with colleagues unable to attend. Now, first, I'd like to just make some comments. A controversial area now is, should the attorneys use, or should they use MD life care planners or non-MDs? Now, up till now, or recently, about 95–98% of all life care planners were not MDs. They were nurses or lay people. A lot of doctors, particularly physical medicine and rehab, have gotten into the life care planning business because they see the earning potential of it. Now, there are pros and cons of having doctors versus non-doctors. Typically, a life care planner is going to testify about the numbers, what the numbers add up to in future hard medical costs. They're not really in the court to give, for the most part, medical opinions. That's usually left up to the treaters. Now, one of the negatives, if you have a doctor, sometimes doctors can't help themselves. They go too far and talk about medical treatments, surgeries that they've never even done before, or don't know what they cost. That can cause problems, and they can be doubted out. With a non-MD, their cross-examination is really confined to the pricing. Can their prices hold up? Can the costs hold up? And, that's really the plus and minuses. I don't think is a big advantage one way or another. Now, it's always helpful to have a medical foundation provided by treaters. That's critical. Now, I'd like to ask Linda a few questions.
Hi, go ahead.
Yeah, hi, Linda. If the treating doctor that you want this medical foundation from, if they're not cooperative, what can an attorney do to get that foundation to help the life care planner fill in the blanks?
Okay, well, the standard of practice in life care planning is that the life care planner can only testify and opine on their area of expertise. So the process is to reach out to the treatment team. Now, because I am an RN, I can express an opinion on nursing care and home care. And then you would reach out to each one of the treating doctors. That's the ideal situation, but that doesn't always work out. The next stop would be an IME physician or someone that you have asked to be an expert on your case. And they would then express an opinion and give some recommendations for future care. If that doesn't work out, then the last stop would be published clinical practice guidelines so that there is some basis and some foundation for the treatment that these people are going to need. Catastrophic cases are usually, it's not difficult to get the treating doctors to cooperate because their patients are very critically injured. The lower value cases, it's a little more difficult. A lot of physicians don't want to testify. They don't want to get involved in anything that has the word lawsuit attached to it. So that's where the challenge is. And, an experienced life care planner has methods that we get the information that we need so that we produce a credible, reliable report that you guys can use. The worst thing is to make you pay for a report and then it's worthless. So a certified life care planner knows what they're supposed to do to get the information that makes their report reliable and credible.
Okay. Linda, another question. Medical cost projections versus life care plans. Having done both, how is the approach to doing them different, if at all?
Well, the medical cost projections are done off the medical records. Unless there's absolutely nothing in the records that we can use to project future care. So, I usually work with the attorney and do whatever we need to do. If it's send a letter to the doctor or somehow figure out a way to get the information in a reliable, credible way. But it's typically done off the medical records. So when an attorney has a narrative from a physician, the more detailed the narrative, the better the cost projection will be. A life care plan is held to a totally different standard. And that's, like I said before, where you need to reach out to the treatment team and try to get the input from everybody who treats your patient, your client, and their future care needs.
Okay, got it. Now, I'm going to respond to some questions that have been placed by attendees. First question, will you be getting copies of the slides? And as I said earlier, you will. We'll be sending it out to everybody who attended today and also to those that signed up but couldn't make it. Another question, how quickly can I obtain a life care plan and or vocational reports for an Erb's palsy case? Well, if you have the records, we can usually get it turned around, assuming your client's cooperative, easily reached. We have all of the records. If we need to, I have some life care planners that could turn these cases around in a week or less. Not that we look for those cases, but that's just part of the business. And for those cases, though, we do charge extra. Typically for medical cost projections, another $500 or 20% extra if it's on a lien so that we only get the cases that are absolutely necessary to be done that quickly. And I'm taking another question. In an MVA, where one passenger was hurt much more than the others, how would you distinguish who should have a life care plan or a cost projection? Well, my feeling is if you're early on in the case or pre-lit and you have multiple plaintiffs, I would probably start off with a medical cost projection for each person. Remember that we want to use this for possible early settlement, pushing up the reserves. I think you can avoid the additional expense of a life care plan this early on by just getting a medical cost projection, unless it's a catastrophic injury. Our experts are able to upgrade a medical cost projection into a full life care plan later on in the case if it doesn't settle, and you would get a credit for that. And let's see. Also, what types of specials did the examples you cited have? How are you valuing a $50,000 case? Well, we're valuing these. It's really up to the attorney who's closer to the client. You know, has interviewed them. You have some early medical bills. You know, they may have missed some work. You know, the sort of specials we're looking for are medical treatment bills, bills for MRIs, radiofrequency ablations, surgeries, obviously, or future procedures that have been requested by the treating doctors. That's always critical. You don't need to wait till the client has finished treatment. You don't want to. As long as you've got a good idea what the future holds for this client, get the plan done sooner than later. There's no advantage at all to waiting till the end of the case.
Sometimes, I'm going to interject there, Elliot. Sometimes it is too early because then we're going to miss things that, you know, as an expert, we know this person's going to need X, Y, and Z treatment. It's not in the records, can't put it out there yet unless you have a narrative that explains that, or it's just too early in the case. And what happens in those situations is we review and we will discuss with you our thoughts about, you know, how to proceed, because sometimes a case will start out as a life care plan and it really should have been a cost projection, or it starts out as a cost projection and it has to transition into a life care plan. So sometimes it's an ongoing process depending on what's going on with each case.
Okay. Another question. Let's see. When you say risk-free, what if the plaintiff recovers, but it's a low amount? Meaning you take it on a lien. Let's say it's $8,500, a life care plan, and but you only come up with, let's say, $75,000 or $100,000 on the case. In those cases, we'll sit down. Our underwriter will negotiate with you, and it's not infrequent that, you know, we've reduced the lien amounts. It doesn't happen much, but of course it happens for various reasons. In the lien situation, can't the client complain that the amount is so much more than had the attorney paid up front? Well, that's something that the attorney is going to have to explain and discuss with the client. You know, I'll leave that to the attorney to finesse it, because you know it is an expense to the file. There's no interest charge. I've seen one or two attorneys, when they've gotten very large settlements, just pay the expenses themselves out of their fee when the fee was that large. Next question. What are the life care planner's fees for providing testimony in trial? It varies slightly per expert. I've seen it anywhere from about $3,500 to about $5,000 or $6,000 per life care planner. Economists and vocational experts are a bit less. Probably they're in the $3,000 to $4,000 a day range. And by the way, in this COVID environment, we're seeing more and more plaintiff examinations, some deposition testimony done remotely through Zoom or through Skype, and that's helping actually to save some charges for transportation and travel. Let's see, do we have any other questions? I don't believe so. Well, that completes the presentation. I appreciate your time, and we'll be sending the slides and the presentation to everybody that attended. Again, thank you very much for your time.
Be well, everyone.